Hi, my name's Louise. I'm one of the cardiac physiotherapists at Ashford Hospital. This short video will firstly outline how to best protect your healing chest following cardiac surgery. This part is relevant if you've had an incision through the chest bone. The video will also cover how to manage and progress your exercise once you leave the hospital. This part is relevant for all heart surgeries with either an incision through the chest bone or through the side of the rib cage. When getting out of bed, you should do it in the following way. Take the backrest of the bed down to flat or near flat. Keep your elbows close to the side of the body. You can use a chest support pillow to support. Bend up your knees, roll onto your side, bring your legs forward and off the edge of the bed. Use your bottom elbow and top hand to push your body up into sitting if required. Aim to use your arms the least amount possible. Once on your side, you can also use the backrest elevation of the bed to help if required. When you stand from the bed or get out of the chair, you should aim to use your arms the least amount possible. Lean your upper body forward and press firmly through your heels. Only use your arms as you need. If you need to use your arms to push up, ensure you use both together and keep them held close to your body. It's very important that you support your chest firmly prior to coughing. Coughing exerts significant force on the chest wound. By supporting the chest well, you'll decrease pain and assist the chest bone to heal. Ensure your elbows are contacting the outside of your rib cage as shown. Then gently rest your forearms and hands across your chest. You can use a small support pillow if you wish, but it's not necessary. Apply pressure inwards to the side of the ribs, aiming to hold the rib cage together. Take a deep breath, then cough. Try again if your cough is moist and you need to clear phlegm. Exercise is very important for heart health. It improves your recovery and ability to return to an active lifestyle. It reduces the risk of further cardiac problems by making your heart work more efficiently, improving circulation in your arteries, lowering your blood pressure and pulse, which means your heart doesn't have to work as hard, and assisting with weight control. The best type of exercise following cardiac surgery is aerobic exercise. That is, exercise that works large muscle groups and works your heart and lungs. This improves your fitness and endurance. Good examples are walking, cycling, swimming, dancing and circuit training. On leaving hospital, you should start a walking program every day or a minimum of alternate days. Start walking on flat ground, but you can start gentle inclines after 2 weeks. Walk at a time that suits your daily routine, but avoid extremes of temperature and don't walk immediately after a heavy meal. Initially, you should start with short walks of 5 to 10 minutes and aim to build them gradually up to 30 minutes as able. Once you've achieved 30 minutes of walking, it's recommended to walk this amount or longer if you're able, on most days of the week. It's recommended to measure your progress each week with a watch, phone or activity tracker. This way you can see if you're improving. Progress your time and pace as you feel able. As you become fitter, your pace and confidence will naturally improve. Walk slowly for the first and last 2 to 3 minutes of your walk to warm up and to cool down. You should be improving when comparing week to week. This is more helpful than comparing day to day. If you feel you're not making progress with your walking program, you should speak with your GP or your cardiologist. To measure the intensity of your exercise, you may choose to use an exertion scale or the talk test. This exertion scale rates how hard you are working. It's particularly useful if you're on medications called beta blockers, which keep your heart rate low, or you have trouble taking your pulse. When you begin exercising, aim to work at 2 to 3 on the scale and later work up to 4 on the scale. You should puff lightly when exercising at a moderate level. This means you can speak short sentences while exercising. If you can't get more than 2 to 3 words out before taking a breath, you're working too hard and should slow down. The following warning signs are an indication that you're working too hard and should slow down or stop. Angina, chest tightness, excessive shortness of breath, dizziness or lightheadedness, extreme clamminess or sweating, or excessive fatigue. Most of these signs and symptoms will subside when you take a rest, but if they become a regular occurrence, you should speak to your GP or cardiologist. Now begins your road to recovery following cardiac surgery. Although there may be some days when you feel pain, fatigue or emotionally up and down, the trend should be a weekly improvement in activity and endurance. If you feel you're not making steady progress, it's again recommended that you discuss this with your GP or cardiologist. Following heart surgery, you should avoid lifting, pushing or pulling anything greater than 5 kilograms of weight to protect the healing chest bone. This includes the following activities: carrying grocery bags, suitcases or washing baskets, lifting small children, walking a dog on a leash, vacuuming, lawn mowing or making a bed. Where able, all day-to-day activities should be done with arms held close to the body and avoiding the use of just one arm outstretched from the body. Following this self-guided exercise program at home, you'll be invited to attend a cardiac rehabilitation program at Ashford or your nearest participating hospital. This is an excellent way to progress your fitness and strength and receive valuable education on exercise, diet and medication use. We hope you found this information helpful and we wish you all the best for your recovery.
Please remember that the information contained in this video is general advice only. You should always follow any specific advice and instruction given to you by your surgeon.